Good day everyone, I am Kim Huevos, and today I will be showing the steps that you need to do during a trauma assessment. So without further ado, let's get started.
So my scene is safe. So the mechanism of injury is a motor vehicle accident. The number of injured is 1. Due to the mechanism of injury, I will be requesting for EMS help so that I can consider the stabilization of spine. I'll put this patient in a C-spine precautions. And I will have my partner hold the manual inline stabilization of head and neck injury. I will now verbalize the general impression of the patient. My general impression is a motor vehicle accident with possible multi-system trauma. We'll now check the level of consciousness. Ma'am, are you okay? The patient is responsive. Since the patient is responsive, the chief complaint would be multi-system trauma. I'm gonna go down to ABCs, but first to check for some secretions. We'll now go down to the ABCs. So for the airway, we would look, listen, and feel. I would look at the rise and fall of the chest. We'll also check if there are any secretions or disruption in the patient's airway. Now I'm going to listen for any breath sounds. The patient is breathing 24 times per minute. This is also shallow, that is why now I will place an oral adjunct. Because of this, we also checked her SpO2. It is at 92%. We will place her in a non-rebreather with high flow oxygen. Next would be the circulation. We will check for the patient's radial pulse. It is said that the patient's pulse is 112 beats per minute. It is also seen that the patient's skin is pale and cool. Due to the breathing and the mechanism of injury and the mechanism of this accident, I have requested this is a priority transport. I want to get a full set of vital signs when my partners just get blood pressure, the breaths per minute, get the pulse again, and also get the SpO2. So the patient's blood pressure is 92/64 and the pulse remains at 112 beats per minute, with the SpO2 at 94%, and the client's respiratory rate is 22 breaths per minute. Because of this, I will start assessing my patient from head to toe. I will also expose my patient and check for any possible injuries she has ever had. I will first check the head if I could feel anything or are there any abnormalities. We will also check the cheekbones and the eye socket, and then check the client's eyes if the pupil is responsive. We will also check the ear for any secretions. We will now go down to the neck. We will check the jugular vein distension. We will go down the chest, and then her trachea midline is okay. I do not note any crepitus, and her breathing is bilateral. The rise and fall of the chest is okay, and now I'm going to palpate her abdomen. There are no noted traumas, and her pelvis is stable. I will now go down with each extremity. I will be palpating each leg, checking for blood. As I go down, I will also check the fetal pulses. After this, I will now check the leg. I work myself up as I go on an exposed leg. And again, I will check for any blood or any crepitus. You will also note for any swollen part. There is also no signs of rotation due to the mechanism of the accident. And since there is no crepitus in her pelvis, then we can move along with the traction splint for the long bones. So while my partner is getting that, I will go back to the upper extremity real quick to check again if there are any abnormalities. Upon checking them, I can note that there are no problems or any abnormalities. Now we will manage the secondary injuries and the wounds appropriately. I want to reevaluate the traction splint. I want to bandage up those venous bleeding that was on her head and just basically monitor her vital signs. And I want my patient to be ready for transport, so I'll go ahead and place her on the backboard. And I also need to evaluate the spine. Now here is the backboard. So I will unroll the patient towards me. I will now feel if there is any fetus nor deformities. We will now move the backboard towards the patient and then lie her again with the hands supporting the head, the neck, and the back. Then 1, 2, 3, make sure that the client is positioned well. After this, we will now again reassess the patient. Now finally, our patient is ready for transport.
That will be all, and I hope you learned something today. Bye!